Thank you very much. I now turn it over to the third-party independent, the member from Ottawa South.
Thank you very much, Mr. Speaker, and it's a pleasure to respond to the minister's statement. And I do want to begin by thanking the minister again for making that commitment to Regulation 552 and the minister from the member from Windsor West. But I also did have a chance to say thank you to Dr. Darren Cargill, who pushed this through the OMA, Hospice Palliative Care Ontario. And I had the honour and the privilege of working for 4 years at the Ministry of Health as a PA, and I worked with really great staff at the ministry. And I want to thank them, the people who worked on this solution. And it's important that we recognize their work. Now, Dan's Law is actually a microcosm of the challenges that I think we face and that this bill faces. And that is that there are things that fall between the cracks. There are connections that are not there. And what happens at the end of the line? The people who feel the impacts are patients and their families. And that's really hard to see, right? You can't see that. When that service isn't there, like my mom had a stroke. So I got to tell you, the only thing that mattered when 2 days after her stroke was my mom and that 4x7 bed. Nothing else matters. And that's why people send us here. They send us here, they say, take care of my health care. Sometimes they don't know it, but they're saying it when they need it. So I think the risks are here in this bill is the elimination of local decision-making. I think driving decision-making towards a central agency, I believe this, and I'll lead into why. Into downtown Toronto, I was around 20 years ago, so I've seen what restructuring, centralization, and bureaucratization can do. In Ottawa, we had to fight to keep the Montfort Hospital because the decisions were being made here. The local component was out. We fought to keep the Cheo Cardiac Unit. We had to fight. Communities shouldn't have to do that. There are local community-based solutions to healthcare. We have successes. I just believe that we need to build on those, and I'm concerned that this bill will not, and we will lose those things. We will lose those gains. And it's critical that we all get this right. So, c'est très important les réseaux pour les
The Francophone Healthcare Network is very important. Eliminating this Francophone network concerns me greatly because the Franco-Ontarian community in Ontario is different. They have different needs. It's very important to recognize this difference, and I'm very concerned regarding these changes.
I'm also concerned with the rate of change. I know the minister said this morning it's going to take a long time. In healthcare, 3 years is a blink. It takes 12 years to build a hospital. It takes like 4 or 5 years to build a hospice. It took 10 years to measure and get wait times and get them down. And I think the pace of change, I think it's fast. I think it's a big change. There are things that are good in terms of people having access to their records and us using data better. That's really important. The concern, though, is that that rate of change will create a situation where people will fall between the cracks. And that's a great concern. That's a really great concern. So that's the thing that, I'm as we go through this bill and we have further debate on it, I look forward to debating the minister and my colleagues across the way. We have to get this right. I know we're in a partisan environment here right now, but it's not. This issue, it's at the end of the day, all of our communities are telling us the same thing. Get it right. And there's a reason that sometimes our change is incremental, and that's because we build on those things, those successes that we've had, and that we want to be careful not to do things too quickly and have an unintended result that we don't see right away, like Dan's law, where someone is in a very vulnerable position and can't get the services that they need. And that's my concern, and I want to thank my colleagues for your time and attention.